So today I'm going to share with you some of my favorite exercises that help reduce your hip pain. I'm Dr. Matt Bradbury, family corrective chiropractor here in Georgetown, Ontario, Canada. This is our practice, One Life Family Chiropractic. Today I want to share with you 3 simple exercises that time and time again have proven effective in terms of helping reduce hip pain, getting you moving more, and just helping you live more full out. And now remember, if things are stuck and not moving properly, you have to fulfill the requirement of movement to help yourself get back on track. And much of that, if you're sitting all day, remember, if you're sitting and you're flexed over like this all day, your hip flexors may be getting tighter, things may be getting more stiff, all the small muscles in the back of your skull may be getting tighter. So many times I will see people who may have hip pain, but oftentimes this is only the beginning in terms of maybe they're achy and stiff down here, and that's one of the areas they feel. But I also encourage them to consider the health of their spine and their nervous system, because guess what? All the nerves that start here travel all the way down to your hip, coordinate how you move, and the whole input-output system, which we call your nervous system, which talks to your muscles, your organs, and helps with your healing. So some of the things you're going to feel and some of the things you're not going to feel. That's why it's so important to get tested to know what's going on the inside. So consider the health of your spine and nervous system. And I'll share with you today some of the exercises that I've used regularly and some of the things that I come back to time and time again in terms of sharing with practice members in the office and just sharing with the community in terms of how you can get more out of your body, especially if you're sitting flexed all day. Maybe you're not managing your stress as well as you could, and your muscles may be stiffer and tighter, and you're not moving the way you had hoped. So first of all, number 1, you have to address all the small muscles around your hip. And how I mean is you're going to have to do specific exercises to help strengthen this region. And a lot of times this area just does not have the conditioning that it should. So I'm going to share with you on the side plank, which is great. Coordinating your side plank with your core and your glutes this is going to be an excellent exercise. So what you're going to do is just come down like this, and you're going to start just like this. But what I'm doing is I'm going to come up, and you're going to see me come up. I'm going to keep my arm up just to engage my upper back, because I think we can work on our posture as well at the same time. And with this routine, I'm going to do 20 seconds here, and then I'm going to flip over and do 20 seconds on the other side, and then rest for 20 seconds. Now you're going to repeat that 3 times. So I have 20 seconds working with the right hip down, 20 seconds working with the left hip down, and then I rest for 20 seconds, and then I repeat 3 more times. Excellent way to start with your hip conditioning. Remember, you're conditioning your glute med, all those small muscles, as well as your core, your obliques, and everything is tied together in terms of also thinking about your posture and reconditioning it with your hip. So start right there. Number 2 is you're going to be in the quadraped position, just like this. And what you're going to do is actually have your hips work with your upper body. And all I'm going to do is I'm going to kick my left leg out. And now just because maybe my left hip is bothering me, I'm still going to work on my right one. So work on both sides. But what you're going to do is come up just like this and back down, being really careful not to sway your hips side to side. When I come up, I pause and back down. Now again, you can make this a working set. You can do 20 seconds on one side, and you do 20 seconds on the other side, and then you can take 20 seconds of rest and repeat 2 to 3 times. So you can really work with those 20 seconds of work ratios to 20 seconds of rest, and you can put yourself together a circuit of 2 to 3 rounds to help condition your low back with your hips, because it's all tied together. And again, those are some of the exercises that have worked really well with patients who may have hip pain in the past, and what you should come back to on the daily to help condition your hip with your core. So this last and final stretch is really just the 90-90 stretch. And what I find is you go back and forth side to side. I may hang out here anywhere from 30 seconds to a minute. I let my knee drop as far as I can, try to keep my torso upright. And what I'm doing is hanging out here for a minute, and then I'm going to go to the opposite side. But again, you're working on the internal and external rotation of your hips. And you can switch side to side, just like this. And as you get more mobile, you may find that one side goes down to the ground easier. I notice my left side drops easier. My right hip on that internal rotation is actually more stiff. So I may spend an extra minute just working on my right side, dropping down like this, just like so. And what you can do is work that stretch in daily. You can make it, as soon as you sit down for your moment at night to relax after, kids' lunches are made and everything's prepped, your lunch is ready for tomorrow, you can take a moment to work on you for a few minutes and work on that hip routine as well as work on the stretching. And the important part is that you are consistent. If you are consistent over a period of time, you will often notice the biggest change. And the most challenging part is not doing it all on Sunday, but rather finding a few minutes, preferably 5 to 7 days a week, where you work on your hips, strengthening them. Many people, in terms of, they work on simply moving more and strengthening their hips and stretching them. You find, in terms of being impactful, you get more mobility, and you may find more comfort with that as well. So consider those simple things that you can do on your own at home. Also consider the health of your spine and your nervous system, as that typically will play a role in your healing as well, and your mobility and your comfort and your ability to heal and work at your best. So consider those things, bring it all together, and make yourself a consistent routine. I hope you found that useful. If you have any questions, put them in the comments below. If there's something you'd like to hear in the future, please send me an email or put it in the comments below. I love creating content for you and some things that are useful for at home so you get the most out of life. Okay? Otherwise, my only ask, I got a big mission, as I've asked before. I got a big mission in terms of helping people understand their health more and getting more out of their body, and understanding that more function equals more health, and their spinal health, spinal nervous system health is vitally important as well. And I simply can't do it alone, so I really do appreciate your help. If you take a moment, grab this URL, share it off to your feed so someone else can get the benefit. If you know someone specifically who's been suffering with stiff hips or sore hips or hip pain, please take a moment, grab the URL, send it to them, and do them a favor too. I greatly appreciate it, and I hope you're having a wonderful day out there. Thank you so much, and we'll talk to you soon. Bye for now.
Did you know just a few minutes of movement can lift your energy, helping you feel more vibrant and awake throughout the day? Thanks for watching.